absence of the insulin. And the insulin is produced by the islets of Langerhans. These are the cells which are called as the beta cells that produces insulin, and this insulin leads to a decreased blood sugar level. The islets of Langerhans also has alpha cell which releases glucagon, and that leads to blood sugar level increase. So before heading ahead, just quickly understand the different types of diabetes. Type 1 diabetes mellitus, which is also called as the insulin dependent diabetes mellitus. This diabetes was previously called as the juvenile diabetes. This older term was used because type 1 diabetes was most commonly diagnosed in children and adolescents. Today, the term type 1 diabetes is preferred. It's an autoimmune disease. The body's immune system attack and destroy the insulin producing beta cells in the pancreas, result in an absolute insulin deficiency. Very little or no insulin is produced. It usually appears earlier in life and it requires lifelong insulin therapy. Next is type 2 diabetes mellitus, which is also called as a non-insulin dependent diabetes mellitus, characterized by the insulin resistance. The body cells don't respond properly to insulin. Also involves relative insulin deficiency. Although the pancreas makes insulin, it is not enough or not used effectively. So it is most common form of diabetes, and treatment often starts with lifestyle changes and may include oral medication or insulin over time. Now the third is gestational diabetes. It develops during pregnancy and is first diagnosed in this period, caused by the hormonal changes in pregnancy that leads to insulin resistance, often has no or mild symptoms such as increased thirst and urination, and usually resolve after the baby is born. That's very important. Now let's understand what is secondary diabetes. Diabetes that arises as a result of another medical condition or treatment. So in this case, the diabetes comes second. Okay, there is a medical condition that causes diabetes. The causes may include the hormonal disorder like Cushing syndrome, pancreatic diseases like pancreatitis, cystic fibrosis, and certain medication or toxins like steroid. Treatment include managing the underlying cause plus controlling the blood sugar level. So let us understand the codes that we use for the diabetes mellitus. There is a range of code from E08 to E13, and every code represents a different type of diabetes mellitus. E08 and E09, they come under the secondary diabetes. One is due to underlying condition, one is due to drugs which are medically prescribed. E10 is type 1, E11 is type 2, E13 is other specified diabetes mellitus. And then we have a gestational diabetes which begin with the letter O, O24. So we will go into the detail of all this diabetes. So let us begin with the guideline, and we know that type 1 diabetes we code it with E10 and type 2 diabetes we code it with E11. But in 2026 the codes have become a lot more specific, and we have a code E10.A that is a pre-symptomatic type 1 diabetes, and we have a special code for that. So kindly make a note of that, which is a sign for early stages of type 1 diabetes before symptoms appear. Now, some more guidelines are the type of the diabetes not documented. If the type is not documented in your documentation, then we can use is as a type 2 diabetes, and diabetes and use of insulin or other drug. If the type is not documented but the insulin is used, we can assign E11, that is a type 2 diabetes. And then we add Z79 codes. It is to show the long-term medication use. And we have the code for the insulin, we have the code for the oral hypoglycemic drug, and we have the code for injectable non-insulin drug. So if the multiple drugs types are used, assign all applicable Z79, means all these codes. Now there is one important guideline that do not assign Z79.4 if the insulin is used only temporarily. See, many a times the type 2 diabetes patient can manage the sugar level without taking insulin. But suppose if there is a surgery, for the precaution, doctor will give a one shot of insulin just prior to the surgery. So that is a temporary, and for which we do not write this code because it is mainly for the long-term medication use. So these are some guidelines. So here I have given the three drugs and how do they act to reduce the level of the sugar in the blood. So you can just go through. This is just for additional information. Now let us understand the gestational diabetes, which is also called as a pregnancy-induced diabetes. So during the second and the third trimester in the patient who is not diabetic prior to pregnancy, this diabetes develops. It may causes the pregnancy complications similar to the pre-existing diabetes, and it increases the patient future risk of developing diabetes. And this particular gestational diabetes is coded by O24.4. So we have seen that we write O24.4 for the gestational diabetes mellitus. And remember that we do not assign any other code from O24 category with O24.4 because those are the code for the pre-existing. This is the code for the gestational. And if you look at this particular gestational diabetes code, it includes the diet, it includes the insulin control, and it includes the oral hypoglycemic drug. So this is a combination code which talks about the diabetes and the control. Remember that. Now let us understand the treatment coding rules. So if it is treated with the diet control and the insulin control, we will assign only one insulin control code. Remember, so this is the control, this is the code for the diet, this is the insulin. And if the patient is controlled by both diet as well as insulin, we'll just write one code. And same applies for the oral hypoglycemic drug also. And we will never write all this code. These are for the long-term use of insulin along with the gestational diabetes code. This is very important because this code includes the control. So there is no need to write this separately. Now let us understand the difference between the pre-existing and the gestational. Pre-existing diabetes is diabetes existed prior to pregnancy, and gestational is diabetes caused by the pregnancy. So here the diabetes is already there in the patient and she gets pregnant, while here the patient gets pregnant and then gets a diabetes. And these are the code for the pre-existing and this is the gestational. So we'll never write these two code together, remember. Now, what is abnormal glucose tolerance test is ATT. It is assigned by the code O99.81, that is abnormal glucose tolerance. It is basically your blood sugar level stays higher than normal after drinking a glucose solution and your body is having trouble using the insulin effectively. And you may be at the increased risk of developing diabetes. And this is a test usually carried out for all the patients who are prone or showing some sign of diabetes. Now let us understand a complication due to insulin pump malfunction. What is insulin pump? It is actually a mechanical device that is used by many patients and that releases the insulin that is required for this diabetic patient. And whenever there is a mechanical complication or there is a malfunction of this insulin pump, the patient either will receive more insulin or the patient may receive the lesser insulin. So we use the code T85.6, which describes the type of the pump malfunction, like the failure, mechanical defect, or disconnection. And this is the principal or the first listed code we will write. So I will explain in detail in the next slide. Now, due to the pump failure, there could be underdosing or the overdoses. So, if there is an underdosage of the insulin, how will we code it? So, the first code is T85.6, which talks about the pump malfunction. The second code has to be the underdosing of the insulin, and for which we use this code T38.3X6, and then there is a dash. So there is a 7 character required. The third code has to be the type of the diabetes, whether it is a type 1 or the type 2. And then we need to also assign a code for any complication that resulted from the underdose if documented. For that, kindly read the code language very carefully because most of the diabetes mellitus codes are the combination code which talks about the type as well as the complication. And documentation is, if the diabetes type is not documented, then the default type is type 2. So let us take one example how we can code this. A 35-year-old patient with a type 1 diabetes mellitus arrives at the emergency department with a symptom of hyperglycemia, including excessive thirst and fatigue. The patient reports that their insulin pump stopped delivering insulin due to mechanical failure. The provider confirms the underdosing of the insulin caused by the pump malfunction, resulting in hyperglycemia. No complications other than hyperglycemia are documented. So how am I going to code it? The first code has to be insulin pump mechanical complication T85.614A, because it's a initial encounter. So you can see this code breakdown mechanical of the insulin pump. The second code has to be T38.3x6A, that is a underdosing of the insulin and oral hypoglycemic antidiabetic drug. And the third has to be E10.65. Now you can see here this one particular code is talking about the type of the diabetes and whatever the symptoms or the complication the patient has. So this is a combination code, so we are only writing 3 codes here. Now let us understand how we can do the overdose of the insulin pump failure coding. So in that case also the first code has to be the T85.6 mechanical complication code specifying the pulp malfunction. The second code here, pay attention, this code is T38.3x1. This is because poisoning by the insulin or oral hypoglycemic drug. Because why? There is a overdosage. Overdosage is always written by poisoning. Third code has to be the type of the diabetes, whether it is a E type 1 or type 2, and also assign the complication resulting from the overdose. So pay attention here whether we need to write additional code or the combination code talks about the type and the complication. Now let us take one example to understand, this guideline. 42-year-old patient with diabetes mellitus arrives at the ED with sweating, dizziness, confusion, and shakiness. Blood glucose is critically low. The provider explains that insulin pump malfunctioned, the tubing kinked, and then suddenly released, delivering large, unintended bolus of insulin. Now, in this case, the correct coding will be T85.614A, that remains the same because it's a breakdown. The second code is T38.3x1A, that is poisoning by insulin accidentally, because there was no intention behind this, so we will write accidental. And the third code, that is very important, because here the type of the diabetes is not mentioned, and we have a guideline that if it is not mentioned we can assume very well it is E11, and that's why we are going to write E11.649 type 2 diabetes mellitus with hypoglycemia. So this is how we are going to code this particular scenario. So we have seen what is the secondary diabetes mellitus. It occurs as a result of another condition. And what are they? It could be a cystic fibrosis, neoplasm of the pancreas, removal of the pancreas, which is called as a pancreectomy. It could be the adverse effect of the drug. It could be a poisoning, sequela, but other underlying medical condition. And the codes used for the secondary diabetes, they are classified when it is because of the condition. E08, E09 is because of the drugs, and E13 is other specific diabetes mellitus. So these are the code. Kindly read the code language if they include the complication or the manifestation. Now in that secondary diabetes mellitus, the next guideline is long-term use of insulin. Patient with secondary diabetes mellitus may routinely use insulin, oral hypoglycemic drug, or injectable non-insulin antidiabetic drug. We will assign the code Z79 to indicate the long-term use of medication when documented. Assigning and sequencing the secondary diabetes code and their causes. The sequencing of the secondary diabetes codes, how to write it. See, there are 3 different types of diabetes, secondary diabetes code. So we need to find out which code will fit in. So let's assume that there is a secondary diabetes due to pancreectomy, that is removal of the pancreas. Now in this case, the first code has to be E13, which is the principal or first listed diagnosis. Second code has to be E89.1, that is a post-procedural hypoinsulinemia. That is a condition which causes less insulin. And the third code we have to write Z90.41, which is the acquired absence of pancreas. Now the secondary diabetes mellitus due to the drugs. Now whenever these drugs are given, these are correctly administered medication, but that can cause us adverse effect. Sometimes it could be because of the poisoning of the by drugs, or it could be sequela. Obesity. So the general coding of the obesity is category E66. E66 is overweight and obesity, and the causes related to obesity is E66.1 is drug-induced obesity, while E66.2 is a morbid obesity with alveolar function. The other obesity related code exists outside category E66 are this. One is obesity due to disruption of the MC4R pathway, and O99.21, that is obesity complicating pregnancy, childbirth and puerperia. Codes in the subcategory E66.81 obesity class requires a fifth character to indicate the severity. So if you can see here, this is the code 66.81, and then the fifth character basically talks about the class, and the class is the severity. E66.81 may be reported together with other obesity codes in chapter 4 and 15 to fully describe the condition. Why this obesity is there. So in case if you want to describe it, we can take the help of chapter 4 and 15. And then if both the class 3 obesity and morbid obesity are documented, assign only one code, the appropriate class 3 obesity code. Remember that. So these are the guidelines for obesity. Now our usual drill that we have gone through all the guidelines, we will take the question to understand them better. So the patient presents to the ED with hyperglycemia due to an insulin pump mechanical failure that causes an underdose of insulin. The provider document type 1 diabetes mellitus without a complication. What is the correct sequencing? Now, whenever there is a question about the insulin pump mechanical failure, we must understand that we need to have three codes. And in that, the first code has to be T85.6. What is the second code and what is the third code? So go through all these things and tell me the answer. See here, the another important thing is we need to find out what has happened to the patient, whether it is an overdose or underdose. That will decide your second code. So if you remember this guideline, the first code has to be T85.6, second code has to be T38.3x6, that is the underdosing, and then the third code has to be the type of the diabetes. This is the type 1 diabetes mellitus. So these are all the code that we will write in this order. Let us take next question. A patient has a secondary diabetes due to pancreatic cancer and is maintained on the long-term insulin and oral hypoglycemic drug. Which code should be assigned for the long-term medication use, and what additional diabetes code are required? So in this case, will we write the code Z79 or not? And if we write, what are the codes that we will write? Tell me the answer. So yes, B is the correct answer. Yes, we do use the Z79 series code for the secondary diabetes, and this code is for the insulin and this code is for the oral hypoglycemic drug. In post-pancreectomy diabetes, which code is sequenced first? And you go through all this code and tell me the correct answer. So yes, in the post-pancreatic diabetes, the first code has to be E13, which tells you what kind of secondary diabetes the patient has. And then of course, we will write the post-procedural hypoinsulinemia, and third has to be acquired absence. Now the next question is, a patient is treated for hyperglycemia due to underdosing of the insulin after skipping doses intentionally. The provider documents type 2 diabetes with the peripheral neuropathy. What is the correct code assignment for the underdose? Now they have asked you only the correct code assignment for the underdose, and we have all this code. So kindly go through them and tell me the answer. So yes, the correct answer is A because it is the underdosing, and that's why T38.3x6. And yes, the answer is type 2 diabetes mellitus. See, after seeing the 11-year-old girl, you might feel that it is a type 1 because earlier the name was juvenile, but we have ICD-10-CM guideline that if the diabetes is not mentioned, we can assume that it is a type 2 diabetes. An 11-year-old girl visits her doctor with her mother because she has been experiencing lethargy and excessive thirst. The physician diagnosed her with diabetes. Based on ICD-CM guideline, which type of diabetes should be coded? Now, this is a tricky question. Read the question carefully and tell me the answer. Let us take the next example. A 30-year-old patient who is 11 weeks pregnant and has a history of diabetes mellitus come in for routine prenatal appointment. Her blood glucose levels are currently well controlled. She manages her diabetes with insulin. Choose the correct set of codes. Now, this is a very intelligent or smart question, and this kind of question you will get in CPC. So, if you read the question very carefully, she has a history of diabetes. So this is the case of pre-existing diabetes, and she is managing the diabetes with insulin. So you have a lot of information. Read everything and tell me the answer. So yes, B is the correct answer because this is the case of the pre-existing diabetes, and like history of diabetes mellitus in for routine prenatal appointment. So she is diabetes first and then she gets pregnant, and then since the type of the diabetes is not written, I can assume that it is a type 2. So I'll be coding O24.111, and the last digit 1 is for the trimester. This is the first trimester because 11 weeks and 0 to 14 is the first trimester, and we will have to code the insulin separately because she has been managing that with the insulin. There is no mention of the short term, so I can use Z79.4, and then this is for the weeks of pregnancy. Let us take the next question. A 45-year-old female patient present for routine follow-up visit for her type 2 diabetes mellitus. She manages her condition with metformin 1000 milligram twice daily and 10 units of insulin glargine nightly. Select the correct ICD-CM code. So this is the case of type 2 diabetes, and she is taking metformin and she is also taking insulin. So that's enough information for you to zero down your code. So yes, C is the correct answer. This is the type 2 diabetes code. We will write one code for the insulin and one code for the oral hypoglycemic drug. A 45-year-old patient with known type 1 diabetes present to the emergency department with severe fatigue, dizziness, and mental confusion. The patient states that their insulin pump had issue and alert earlier, suggesting a potential issue. Evaluation, including labs, identifies hypoglycemia with a blood glucose reading of 50 mg per dl. Further review of the pump shows it accidentally administered more insulin than intended. Which code most accurately represent this encounter? So what has happened? There is a pump malfunction. The type of the diabetes is 1, and it has given more accidentally administered more insulin. So these are the 3 pointers which will help us to zero down the answer. And this is a pump malfunction, so we have to have a first code T85.61. The second code will decide whether it is underdose or overdose. This is definitely an overdose. So you by now you know that 3x6 is for the underdose, 3x1 is for the overdose, and then we need to see what type of the diabetes. So go through all this drill and tell me the answer. So yes, B is the correct answer. This is the first code that we always write for the pump malfunction. Then this is the code for the poisoning. It was not intentional. This is the code for the type 1 diabetes, and this is the code for the hypoglycemia. Read this code very carefully, because here this code does not include the hypoglycemia, and the patient is showing the complication, that is the hypoglycemia, or the symptom, that we need to code it separately. Let us take the next question. A 52-year-old patient present for follow-up care after recent worsening of the chronic kidney disease. The provider document that the patient has a diabetes mellitus caused by the Cushing syndrome, and this diabetes has led to CKD stage 3. No insulin use is documented. Which code set best represent this encounter? Now, first of all, we need to find out what kind of diabetes is this. So this is the diabetes which is a secondary diabetes, which is caused because of the Cushing syndrome. So that will be our first code, followed by we need to code for the. Let us take the next question. Patient with the type 1 diabetes who uses insulin present with complaint of numbness, tingling and burning sensation in both the feet, along with the sharp shooting pain in her legs, especially at night. After a neuromuscular examination, monofilamental testing and nerve conduction studies, the provider diagnosed the patient with a diabetic neuralgia. Which code set best represent this encounter? So here you need to find out what is the type of diabetes. Type 1 diabetes, the patient is having diabetic neuralgia, and patient is on insulin. Now you know the drill, that the diabetic neuralgia is the manifestation of the complication, and then the insulin, whether you will mention or not, that will decide your answer. Yes, D is the correct answer, because it is the code for the type 1 diabetes. This code includes the complication of diabetic neuralgia, and there is definitely no need to code the Z79.4, because that we never write for the type 1 diabetes. Next question. A patient with a secondary diabetes is temporarily placed on insulin in the hospital to control the blood glucose during the acute illness, but does not use the insulin at home. Should Z79.4 be assigned? And we have this four option. Tell me, because it is a temporary use of the insulin, do we write the code Z79.4? No, so we will not write Z79.4, because this is mainly for the long-term use of insulin. A 25-year-old obstetric patient who is 29 weeks pregnant and has a gestational diabetes present for her routine prenatal checkup. Her blood sugar level remains stable. She is controlling her glucose with both insulin and dietary management. Select the correct coding. So there are two guidelines which are involved in this. Kindly go through all the options and tell me the answer. So yes, A is the correct answer, because for the gestational diabetes, we never mention the code Z79.4, because the gestational diabetes codes are the combo code, which also include the kind of control. And here it is insulin and dietary management. In that case, we will write only one code, and that is for the insulin. So A is the correct answer, and this is the code for the weeks pregnant. Next question. Patient is diagnosed with a drug-induced obesity. Which ICD-10 code is appropriate? This is the obesity code, so go through all that and just tell me the answer. Pretty straightforward question. Yes, the correct answer is answer B, which is E66.1, because which is the drug-induced obesity, and E66.2 is basically the morbid obesity. Let us take the next question. A 52-year-old patient develops a diabetes after long-term corticosteroid therapy for chronic asthma. She now reports decreased sensation in both the feet. The provider diagnosed drug-induced diabetes mellitus with diabetic polyneuropathy. She is not using insulin. Which code set is most appropriate? Now, what has happened here is she has developed a diabetes. What kind of diabetes? It is a secondary diabetes. And this diabetes developed because she is taking corticosteroid, and this is a drug-induced diabetes mellitus. So you have all the information. Now tell me the answer. So yes, C is the correct answer. We have to write a code for the secondary diabetes that is caused because of the steroid. And as far as the adverse effect is concerned, and this is the adverse effect of the drug, so there is a guideline here which says that when coding an adverse effect of a drug that has been correctly prescribed and properly administered, assign the appropriate code for the nature of the adverse effect followed by the appropriate code for the adverse effect of the drug. So the nature of the adverse effect is the secondary diabetes, and then we have to also mention the code for the adverse effect of the drug. So this is where we finished a lot of question. I hope that this has helped you in strengthening your guideline, and then we'll see you with the next chapter in the next week.